Welcome everyone today to my Pathophysiology series. I'm Professor Scott Krueger, and today's lesson we're going to be going over some review things that involve the immune system, inflammation, mechanisms of disease. We'll be talking a little bit about burns. So we'll be going through a lot of very important concepts that it's very necessary for you to understand if you want to be successful in your pathophysiology class. So the first thing I want to talk about are just some different types of skin lesions. One of the first ones is called a macule. And macules are kind of these flat, circumscribed changes in skin pigmentation. So an example of this would be like a freckle, a cafe au latte spot, a Mongolian spot. So you won't be able to feel it if you rub your hand on it. So that's a macule. A nodule is a circumscribed, elevated, solid lesion with a depth of up to 2 centimeters. So an example of that would be like a cyst. So you definitely be able to palpate it. It goes a little deep inside the different layers of our skin, and that's a nodule. A papule is a circumscribed, elevated, solid lesion up to only 1 centimeter in size. The elevation may be accentuated with oblique lighting. So some examples of that may be like acne, verrucae. Those are some good examples of a papule. When we talk about the skin lesion plaque, a plaque, that is a circumscribed, elevated, plateaulike, solid scale lesion greater than 1 centimeter in size. And an example of that would be psoriasis. So that's going to be skin that's definitely rough, sort of scaly-like. A pustule is a circumscribed, elevated lesion filled with purulent fluid less than 1 centimeter in size. So an example of that would be like acne. So anything that has pus inside of it, that's definitely going to be in the category of a pustule. And that's kind of easy to remember because it has the word pus in the name. So that one's one of the more easier ones to remember. And then finally we got a vesicle. And a vesicle is a circumscribed, elevated, fluid-filled lesion that's up to 1 centimeter in size. So basically a vesicle will have, be slightly raised, and it'll have typically clear fluid inside of there. And an example of that would be like what we see with the virus herpes simplex. I want to go over some common infections and their causes. So the 3 main types of infections I'll talk about today, we got bacterial, fungal, and then viral. With viral, some common causes of that, HIV, we have our COVID, the common cold, herpes, mumps, chickenpox, measles, and then rubella. So that's our viral type of infection. Our fungal type of infections usually are caused by candida, so that we can have like thrush, our yeast infections, also the tinnias, so all the different types of tinea infections, tinea corporis, tinea pedis, fungal infection on the foot, tinea cruris, and then tinea capitis, fungal infection on the head. With bacterial, some common causes of bacterial infections, we got staph, e.coli, salmonella, and shigella. So based on what type of infection you have, we know that we're going to use different medications to treat those. With bacterial infections, we'll be using antibiotics. And antibiotics won't be effective against a viral infection. It won't be effective against a fungal infection. So we got to make sure that we're using the right type of medication when we're treating these, because if we use the wrong medication, we could create some kind of resistance, and we definitely want to try to avoid that. With our viral infections, we'll be using our antiviral type of medications. And then our fungal infections, we got like tinactin, miconazole. They come in sprays, powders, creams. Many of those you can get over the counter, but of course with bacterial and viral infections, you'll definitely have to see a provider for that. You'll have to get a prescription for that. The next thing we want to talk about, the different types of skin infections. So one of the first ones that I want to talk about is cellulitis. Cellulitis, a common bacterial skin infection, usually involving Staphylococcus aureus. It can cause redness, swelling, pain in that infected area of the skin. If we don't treat cellulitis appropriately with the right antibiotic, it can definitely spread and cause serious harm and health issues. It's very important that we're providing good wound care and hygiene to prevent cellulitis. One of the most common sites for cellulitis to occur, usually in the legs. Cellulitis can occur anywhere there's skin, but more commonly you will see it in the legs. Another type of skin infection, we got impetigo. That is a highly, highly contagious skin infection that causes red sores on the face, mainly affects infants and children. And the main symptoms are these red sores that can form around the mouth and nose. They can rupture, they may ooze for a few days, and then they kind of form this yellow brownish crust. Antibiotics can be indicated for the use of this. They shorten the time length of the infection. And then we also want to be able to prevent the spread to others. So impetigo, you may see cases of it pop up in daycares, in schools, places where there's a lot of young children. So we definitely want to treat that as soon as possible so that it doesn't spread to some of the other kids and you got a severe outbreak. Another type of skin infection we got here, folliculitis. And this one's pretty easy to remember. We got our hair follicles. So folliculitis, just an infection of that hair follicle. Folliculitis can be common in people who do suffer from acne, people who shave and use topical steroid creams are more at risk for developing folliculitis. It may appear as kind of small white-headed pimples that appear around the hair follicle. They can itch, they can be painful. Severe infections can cause permanent hair loss and scarring. Many times with folliculitis, mild cases clear on their own. However, in more severe cases, antibiotics may be needed. Another one of our type of skin infections we got here, paronychia, and that is an infection of the nail, the skin adjacent to that. Usually caused by some kind of injury or irritation, such as like a hangnail, cuticle damage, or people who are continually working where their hands are wet. Paronychia is very common in those types of jobs. Definitely the surrounding tissue is going to be very painful, red, swollen, and there may be pus that leaks out from that area. Treatments include hot water soaks, medications such as antibiotics or antifungals. And very painful sometimes if the pus isn't draining on its own, they may have to go in there and do a little IND, little incision and drainage to release the pressure and get that pus to come out. Another common type of skin infection, herpes simplex virus, and that's the virus that causes cold sores, fever blisters. The next topic we want to go on to talks about important diagnostic procedures. When we're using x-rays, Basically, we're using these invisible electromagnetic energy beams that produce images of internal tissues, such as bones, organs, your lungs. When we're doing a culture, with a culture, what we're doing is we're getting a sample of tissue or some type of area that is in question. We scrape it a little bit, and then send it off to the lab. And in the lab, they will culture it, they'll let it grow, they put it in a petri dish, they let it grow for a couple of days, and then with a sensitivity, they use different types of antibiotics, and they see if something does grow, what antibiotic will this organism be susceptible to or resistant to. So we want to use antibiotics that the organism that was grown is susceptible to. If we use an antibiotic that it's resistant to, it's not going to do any good. So very important that we understand what goes on behind a culture and sensitivity. With a blood sample, we're just doing a blood draw, getting some of their blood from their veins. We send it off to the lab for analysis. And then they look at things like your blood counts, your electrolyte levels. They can look at all types of things with a blood sample. But we use that to keep track of how well we're managing a condition, or we use it to help diagnose any type of condition. Finally, we got a biopsy. Biopsy, very important diagnostic procedure. In a biopsy, we basically remove a piece of tissue or a sample of cells from your body so that we can test that in a laboratory. Undergoing a biopsy can be very important for a healthcare provider to be able to understand what's going on, especially if we are trying to determine whether there may be cancer present. So biopsy, definitely very important to use when we're looking at the different treatments and possibilities of cancer. Definitely some important terms we want to go over related to the immune system. One of the first terms I want to talk about is prevalence. And prevalence is the proportion of a particular population found to be affected by a medical condition at a specific time. So basically, we're just saying how many people have this disease. And we know with kind of what's going on right now, very high prevalence in that virus. We got opportunistic. Opportunistic is important because it's important to understand that we do have bacteria all over our body, and typically those bacteria aren't harmful to us. However, if our immune system tends to be or become compromised, or if we have a weakened immune system, these different types of bacteria or virus, they can become opportunistic, and then they can really start to grow, proliferate, and make you really sick. So a lot of times in people with HIV, it wasn't the HIV that killed them, it was some kind of opportunistic infection that killed them. And today, with all the treatments that we have available for people with HIV, they're dying less and less frequently from these types of opportunistic infections. So opportunistic infections really try to take advantage of someone who has a weakened immune system. And we may see that in people who take long-term steroids, because we know that steroids suppress the immune system. So we always got to be wary of that. We got to know the signs and symptoms of infection. Another important term related to the immune system is regarding immunocompetence. Immunocompetence. And that is the exact opposite of immunodeficiency or immunocompromised or immunoincompetent. With immunocompromised, immunodeficiency, basically we're saying that their immune system is weakened. Immunocompetence talks about the health and the strength and the vigor of an immune system. So it's basically the ability of the body to produce a normal immune response following exposure to a foreign antigen, a foreign invader, something that's not supposed to be inside the body. So that's immunocompetence. It's the opposite of immunodeficiency or immunocompromised. Kind of easy to confuse those two terms. They sound similar, immunocompetence and immunocompromised. So just be very careful that you don't confuse those two. We got nosocomial, and that just basically means a disease that originated in a hospital. We know that people who visit the hospital are likely to pick up things from the hospital that makes them sicker than they already are. So nosocomial, a disease originating in a hospital. Cytokine, that is a term for a broad and loose category of small proteins that are important in cell signaling. And when we're talking about the immune system, it's important to understand that cells that arrive to the scene of some kind of foreign antigen, they send signals out to trigger other cells to come to the area to fight off the disease or whatever foreign antigen is affecting that person. So examples of a cytokine include interferon, interleukin, and growth factors, which are secreted by certain cells of the immune system and basically influence other cells. So it's a way for cells to communicate with one another, to mount the proper defense, to neutralize whatever foreign antigen tends to be in the body. Looking at the term permeability, that's just the ease with which a substance can pass through an organic membrane. So we try to think of our capillaries, our blood vessels, our the walls of our cells. Those, when they are dilated, when they are signaled by histamine, they basically allow increased permeability. And we want increased permeability when we're trying to fight off some kind of infection, because we need our white blood cells to leave our blood vessels and go into the cell to fight off whatever is not supposed to be there. So that's permeability. Chemotaxis. Chemotaxis is the directed motion of an organism toward environmental conditions it deems attractive or repellent, usually in response to a chemical stimulus. So chemotaxis basically just the movement of an organism. And sometimes organisms are attracted to something, sometimes they're repelled by it, they want to get away from it. And usually this organism is moving in response to some kind of signal, some kind of chemical stimulus. So with our immune system releasing certain chemicals, certain chemical mediators, that tells other blood cells, other immune factors to kind of aggregate to the area so that they can help out and get rid of the bad guys. When we're looking at histamine, I mentioned that a little bit. Histamine is a chemical found in some of the body's cells, causes many symptoms of allergies, such as your runny nose, your sneezing. So histamine is definitely released in people who have allergies, hay fever, seasonal allergies, allergies to dust, mites, pets, things like that. So the thing that makes your nose runny and causes you to sneeze, your eyes to water, that's histamine. So what do we take to counteract that? We take an antihistamine, such as Benadryl, Sertrazine, Zyrtec, some of the newer second generation antihistamines. So what happens when histamine is released? Why do we want histamine to be released? There's a reason for it. It's not just to make you uncomfortable. Well, histamine causes vasodilation. which is our blood vessels getting bigger. So that will allow more blood to come to the area. That's a very important factor in our immune system, because we want to bring more blood to an area where there is something that's not supposed to be there, because in our blood we have our white blood cells, and those are very important to help get rid of whatever is offending us. Also with histamine, we got capillary permeability, swelling, and we kind of talked a bit about that. So that's important so that things can migrate out of the blood vessels and then into the tissues so they can do their job. So vasodilation and capillary permeability occur immediately when histamine is released. Another very key term we have here, leukotrienes. Those are inflammatory mediators that cause vasoconstriction. Vasoconstriction. We got our C-reactive protein, CRP. That's an important lab test that we can do that can indicate if inflammation is occurring. So a CRP, that's a protein that becomes elevated following inflammation. And many times, healthcare professionals, they can't see inflammation on the outside. There may be some kind of inflammation going on the inside. And so we do a CRP to see if we can find that there is some sort of inflammation going on that we can't see. And whenever there's inflammation that occurs, we know that there is some kind of injury, or there's some kind of something wrong with our immune system where it may be hyperactive. And that's important in autoimmune diseases. With autoimmune diseases, we have our own immune system attacking our own tissues. And that can be, if it's chronic, that can really do some long-term terrible damage to our bodies. So finally, our last term that we have here, memory T cells. Memory T cells, that's part of the adaptive immune system that is activated upon second exposure to an antigen. So our T lymphocytes can have memory. So if we have gotten an infection before and we fought it off successfully, if we're exposed to that type of infection again, our white blood cells can have memory, and they can immediately mount an attack, a defense, so that we may not even get sick or feel sick. So those memory T cells in a normal functioning immune system, very helpful if we are exposed to a certain bacteria, virus, fungus, whatever it may be, a second time, and then we can mount a very quick defense against that. So like I said, a lot of times people may not even know they got sick because their immune system fought it off. But with people who have an immune system that's compromised, there may be an issue with these memory T cells, and they may not be able to fight off infections as well. Looking at the two different types of inflammation here, we got local inflammation, and then we got systemic inflammation. With local inflammation, it's gonna be particular to one area, right? So I bump my arm, I got a little red area here, it gets swollen, red, warm, painful. If I have sprained my thumb or my finger, that's gonna be local. So it's gonna be one area. And I may even, a lot of times if you do have a big enough inflammation, you may lose some type of function with that. If you've ever sprained or broken your finger, you know that it's very hard to bend that. So the main key things with inflammation, local inflammation, redness, heat, swelling, pain, and then possibly loss of function. With systemic inflammation, that's inflammation that can affect the whole body, So symptoms of that include fever, weight loss, lethargy, and lymphadenopathy. Basically, your lymph nodes can be swollen. And with lymph nodes, when they're swollen, you can palpate them, you can feel them. So the two types of inflammation, local and systemic. Looking at our types of hypersensitivity immune reactions, there's 4 types. We got 4 types of hypersensitivity immune reactions. In type 1, that is a reaction that's mediated by the IgE antibodies, commonly caused by substances that you eat, you ingest, such as shellfish, certain fruits, drugs. And with that type 1 reaction, urticaria usually results. And urticaria is basically itchy hives. So you get these raised skin lesions. They can be very itchy. That's urticaria, and that's with a type 1 hypersensitivity immune reaction. Our type 2 is a cytotoxic reaction mediated by IgG or IgM antibodies, and that usually results from the production of antibodies that fight cellular antigens. We have our type 3 hypersensitivity immune reaction, and that is mediated by certain immune complexes, and with that, aggregates can occur in various tissues, such as in the skin with systemic lupus erythematosus, SLE, also known as lupus. With our type 4 hypersensitivity immune reaction, that is our delayed reaction. It's a delayed reaction mediated by cellular response and can occur in response to direct contact, such as in contact dermatitis. So that delayed reaction, you may touch something like, poison ivy. You don't get an immediate reaction, but eventually, a couple hours, whatever, maybe a day or 2 later, then you get some type of immune reaction. And delayed reactions are difficult because you may not remember what you touched or what you came in contact with, whether it's some kind of like latex allergy, some kind of chemical that you came in contact with. If you don't get a reaction until hours, days later, it's hard to remember or pinpoint, well, what did I touch that I reacted to? So those type 4 hypersensitivity immune reactions can be a little tricky to deal with. Next, we want to talk about the different types of drainage. We got 4 main types of drainage here. Serous, that is a normal drainage. It's thin, watery, clear substance, contains lots of plasma. Serous is normal. Sanguineous, normal, seen in wounds that usually extend below the superficial layers of the skin. So sanguineous, just think of like sangria, right? The red wine. So this is blood that's going to be red. Serosanguinous is a combination of serous and sanguineous, so it's almost like a pink color. So it contains a lot of clear plasma, but then it does also contain a little bit of blood. Those first 3 types of drainage from wounds are normal. Those are normal. Our last one, purulent, that is abnormal, and that is a sign of infection. So that's drainage that can be white, yellow, brown, maybe slightly thick in texture, and what that's made up of is basically dead white blood cells that have been trying to fight the infection, plus the residue of any bacteria that's being pushed out of the wound. So if we do see purulent drainage, that is a red flag. If the patient isn't already on an antibiotic, we need to go ahead and facilitate so that happens. Next, we want to talk just a little bit about some different types of skin cancers. We got squamous cell carcinoma. That is a less common form of skin cancer, usually occurs in African Americans or Indians. It rarely spreads to other parts of the body. So yes, it is a cancer, but if it is caught early enough, the prognosis, if it doesn't spread, if it's not likely to spread, it's less likely that it can metastasize and travel to different parts of the body. We got actinic keratosis. That is a precancerous skin lesion resulting from sun exposure. So many times you'll see this on older men who have been balding. They'll get like these little crusty areas on the top of their head. Actinic keratosis, precancerous skin lesion resulting from sun exposure. We got basal cell carcinoma, a common, less aggressive form of skin cancer resulting from sun exposure. So that's also from sun exposure. Usually it's not too aggressive, so we don't have to worry too much about it possibly metastasizing. However, this last one here, malignant melanoma, that is one of the more poor prognosis types of skin cancer. So malignant melanoma, one of the most lethal types of skin cancers, because it grows very quickly, extends down deep into tissues, and it can metastasize. It can travel rapidly to lymph nodes, it can lead to other organs, and many times it has a poor prognosis. Looking at, I want to go over the ABCDE rule of skin lesions when diagnosing and classifying melanomas. So now we're dealing with melanomas. Looking at the acronym ABCDE, one of the first things that we want to look at is asymmetry. So when we're looking at a mole or some kind of suspect skin lesion, we want to see that it's symmetrical. When it is symmetrical, the chances of it being a melanoma decrease. However, if it is asymmetrical, where the borders, if you fold it over in half and it doesn't match up, that can be indicative of a melanoma. The B stands for border, so that is the outside of the skin lesion. Benign mole, so benign, typically we're not too concerned when something is benign. However, if it's malignant, that is definitely gonna, raise some red flags. So with border, we're looking at a benign mole has smooth, even borders, unlike melanomas. The borders of an early melanoma tend to be uneven. The edges may be scalloped or notched. So looking at the border of some type of mole, if the border of it is nice and even, that's a good thing. If it's kind of jagged, doesn't look normal, we definitely want to investigate further with that. C stands for color. Usually benign moles are all one color. However, if you have a skin lesion that's different colors, different shades of black, different shades of brown, that is very highly indicative. It's a very important warning signal that it could be a melanoma. Some of the different shades could be tan, red, white, blue. So we want to see moles that are all one color. If it's more than one color and has different shades in it, that's not, we're concerned, definitely concerned there. D stands for diameter. Benign moles usually have a smaller diameter than malignant ones. Melanomas usually are larger in diameter and usually can be bigger than the size of a pencil eraser. So if the mole is bigger than the size of a pencil eraser, there's going to be some concern there. Lastly, we have E, which is evolving. Commonly, benign moles look the same over time. They don't change much. However, if you have a mole that is definitely changing quickly, that is definitely a concern. So any change in the size, shape, color, elevation, or some other trait, any new symptoms such as bleeding, itching, or crusting will point to danger. So these are all characteristics of skin damage that healthcare professionals look for when screening for malignant melanoma, one of the most deadly types of skin cancers. One of the last things that we're going to be going over here is burns and the rules of 9. So when somebody gets burned, we like to talk about the rules of 9, and we have to know that the percentage of a body surface that entails this, so that we can estimate, how diffuse, how bad are these burns all over the body, and then what kind of interventions are we going to have to do. So the front and back of the head and neck is equal to 9%. If you only burn the front of your face and neck, that's going to be half of 9%, so that'll be 4.5%. So no, the whole head, the back of the head and neck, front and back of the neck, that equals 9%. If it's only 1/2, that's going to be 4.5%. The back and front of each arm is equal to 9%. So if both of my arms have been burnt completely on the front and back, that'll be 18%. If only my left arm in the front part of it was burned, that'll be equal to 4.5%. The chest, just the chest, equals 9%. Our stomach is equal to 9%. If your whole chest and stomach have been burnt, 18%. The back now, the upper back, 9%, the lower back, 9%. If my whole back has been burnt, 18%. And then each leg, front and back, 18%. So if my whole left leg is burnt, that'll be equal to 18%. If both of my legs, front and back, have been burnt, 36%. If only the posterior part, the back of my left leg, has been burnt, that is going to equal 9%. So that can be a little confusing, especially if you're presented with a question that says, you know, my chest was burnt, the front half of my arm was burnt, and then my whole right leg was burnt. You're gonna have to know those things. So that whole right leg was burnt, that's 18%. Just the front half of my arm was burnt, that's 4.5, so 18 plus 4.5, 22.5. And then my chest was burnt, that's another 9%. So 9 plus 22.5, 31.5% of the body was burnt with that. So you gotta know those rules of nines, especially if you're presented with a question asking you to calculate the percentage of someone's body that was burnt. Lastly, we're finishing up here. Some important considerations with burns are: infection is a major cause of death in a burn client who survives a major burn. So we know that our skin is our first line of defense against infection. If you have a burn, then that compromises your skin's integrity. You're more likely to get an infection. So people who survive a major burn, it can be very, your chances of dying of an infection definitely increase. A significant risk for burn patients is loss of fluids and hypovolemic shock. So you lose so much fluids, you go into shock because your fluid volume has decreased so drastically, and that's definitely a significant risk. Last important consideration with burns, we should not apply ice to large burn areas due to the risk of vasoconstriction and hypothermia. So do not apply ice over large burn areas, as this could cause severe vasoconstriction, which can cut off circulation, or it could also cause hypothermia. All right, we came to the end of this video. Hope you found it helpful. Please hit that like, hit that subscribe button, give me a comment if this pathophysiology video was helpful. I do plan to make many more in the future, so thank you so much.